Who will actually be doing my surgery? This is a common question that I get asked in clinic, and it's a very fair and reasonable question. In clinic, I often have residents and medical students working with me because I work in an academic center. So patients see these individuals with me and want to know who is actually going to be doing my surgery. I heard a breast surgeon give a wonderful explanation about this topic the other day to one of our mutual patients. There are very few surgeries that can be done with only two hands. Maybe something simple like a skin procedure or a very minor procedure in the operating room. But most surgeries require more than two hands. I need help during surgery. If I was doing a surgery by myself, it would take forever. So one, it makes it safer, it makes it more efficient, and allows me just to do it better. But who is helping me? And that depends on where you're having your surgery. For me, working in an academic center, I very frequently have residents helping me in surgery. A resident is someone who has graduated from medical school and now they're doing specialty training within the field of plastic and reconstructive surgery. Sometimes I'll also have medical students scrubbed into the case as well. Scrubbed in means that they are in your surgery, they are sterile, and they might be touching your body as part of the surgery. But it is unlikely that they will be doing anything. How much do I let the residents do? That is dependent on where they are at in their training and how skilled they are at that procedure. If they are an intern, meaning it's their first year after medical school, they probably won't be doing much. They'll be helping, they'll be watching, they'll be learning. If it's someone who's about to graduate residency, meaning they're going to have their own patients in the next couple months, they will likely be doing a lot of the surgery. But that is definitely on a case-by-case basis, and it's different for every resident. I know what they're able to do and not do, and then I judge on a case-by-case basis in surgery what I will let them do. At the end of the day, I'm the surgeon, and I take complete ownership for what happens in the surgery, so I have to be very comfortable with what I let people do. Now that's me in an academic center. I also sometimes have a physician assistant who's helping me in surgery. If you see a surgeon who's in private practice and who doesn't have residents helping them, they might have physician's assistants or registered nurses that are helping them, but it really depends on what type of surgeon you're seeing. But this is a very good question to ask your surgeon, and it's not something that a surgeon should get upset about. But it's a very confusing topic to patients, especially if they're not familiar with the surgical world. I hope this answers your questions. Let me know if you have more below.